Uneven eyelids, eyes. So frustrating. I remember being self-conscious about my eyes since I've been a toddler. I always had uneven eyes, and so does my father, which shows that this is not a disease or health issue, just a characteristic passed on by a parent. I am looking for a way to fix this, and am wondering what I need to do. I am 18 and fairly tired of this issue. I would prefer if there was an alternative to surgery, which I would prefer not to have. I am not wearing any eye makeup to show how they really look. Please help.
Thank you for your question. You submitted photos showing just the front view of your eyes, and you state that you're 18 years old, and since you were a toddler, you were aware of the unevenness of your eyes. You mentioned that your father has the same exact situation, so it's not disease-related, but a genetic-related issue. And you want to know what you can do, and you want to avoid surgery. Well, I can certainly guide you with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and complex issues of the eyelids is the very definition of what we do in oculoplastic and oculofacial plastic surgery. So I'm going to help you first by giving you some guidance as to what I see just from the photos alone. Now, in what we refer to comparing the left eye to the right eye, the upper lids and the lower lids, it appears that you have something called eyelid retraction. And when it's the upper lid, it's the left upper eyelid retraction, and then a left lower eyelid retraction. Now, what I can tell from the photos is if the projection or the prominence of the eyes are different. Now, I think it's reasonable to assume that it may not be, but certainly a proper physical exam, that's one of the things that's measured, is the relative prominence of the eyes. Now, in a situation where it's genetic or it's congenital, I can tell you, first of all, that there is clearly an anatomic issue. And so in that situation, there really isn't a good non-surgical alternative for you. When I see patients like yourself, what I decide is to help them by explaining what I do for patients who have something called thyroid eye disease. In thyroid eye disease, there is an autoimmune process which affects the eyes and the thyroid. And what happens is the eyes can bulge, the eyelids can retract, the eye can look very open, it can affect both eyes. But there is basically a strategy that is to bring the upper eyelid downward, for example, similar to in your situation, by addressing certain anatomic factors. So I explain to patients like yourself that we have to have a plan A, B, and C. And basically with plan A, I work from behind the eyelid to reduce and separate and remove a muscle called Mueller's muscle. This is a muscle that's responsible for about 2 millimeters of height. Now beyond that, we can also do something with the levator muscle, the muscle that lifts the eyelid from the front. But that's getting ahead of ourselves, but essentially there is really only a surgical option in your situation. Now the same principles also do apply to the lower eyelid. In lower eyelid retraction, we can do various types of procedure, from minimal procedures to procedures where we're putting grafts on the inside of the eyelid. In a situation like yours, I probably would consider correcting the upper eyelid first, trying to get that eyelid down to a position which is comparable to the other eye, allow things to heal, and see how you like it. In fact, in our practice, what we do routinely is we'll sit people up during surgery, whether it's for drooping eyelids or for eyelids that are too high, just to see how the eye looks with gravity. This is an art, and there are many different ways to address these issues, but when you get down to it, we're talking about an anatomy issue. And so I would say that if you aren't quite ready for surgery, then wait until you reach a point where you are ready for surgery if this continues to persistently bother you. Meet with qualified experts in this area who have done a lot of these procedures, in particular have familiarity with some situation like yours, a congenital situation. But since this is fairly actually uncommon, the principles of other situations related to eyelids and retraction can be applied, because it is always about correcting anatomy. So learn more about your options and meet with doctors, and once you're comfortable, move forward with a plan that makes sense to you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.